Hey Bre, do you hear that?
Yeah, Maya, I do.
What's beeping? Hey guys, I'm Maya.
And I'm Bre.
And you're listening to What's Beeping, a nursing podcast.
And you realize it really is a privilege, even in the moments of suffering, because that's like a huge question for me. Why we nurse?
But most of the time as well, you see the beauty of nursing.
One misconception of nursing that I had as like a university student was that they just followed orders and they didn't do much, but oh my gosh, like I was so wrong. We do a lot.
Yeah, really good answer. That was really good.
Some people just think like, people go to nursing because you can't make it to med school, or it's a stepping stone, and that's not true. It's different. It's a different side of healthcare that we need.
Going back again to my origin, where I was raised in a refugee community, I still remember when I was maybe around 5 or 6 years old. There is a nurse. I still remember her name and her face.
I am now wearing a red hat to indicate I am recording. Hi, Maya.
Hey Bre.
I miss you.
I miss you too. I can't see you. Well,
I know.
we could see each other, but the internet, it's not so great on one of our sides.
We won't say whose.
We won't disclose that information
It's
publicly.
definitely not yours, though. So.
Mine's fine.
Yeah. We'll make do. Come on.
We'll make do.
It's all
This is
about being resourceful at this time,
I
right?
know. We are
Yeah.
physically distancing. Social distancing. Physical distancing.
So
But we're
much
still
distance
together.
between us.
We're together apart.
I feel it.
We thought we would come together today for Nursing Week. We have a great episode for you guys.
I'm really excited about this one.
Me too.
I got to talk to my friends about it, and yeah, you guys will hear some of our colleagues' voices or past colleagues, and we
Yeah.
asked them some cool questions. It'll be cool.
We've accumulated some nice interviews with nurses that we appreciate for Nursing Week. So we wanted to just kind of give a background of some people's history and their origin stories and how everyone has some type of a history. What you see isn't always what you get.
Yeah, Nursing Week is a bit different this year. It's the year of the nurse, and I feel like we are getting a lot of media coverage. So this pandemic has really shone a light on us, and I feel a lot of love. Strangers banging pots outside their windows and everything. All my family seems to have a new appreciation for me, which is nice, and friends too. And yeah, I do feel very loved this year, especially.
Yeah, this year is definitely one to remember. We're going to be a part of history, if you think about it.
Totally. So we're not going to talk a lot about COVID-19. We want to try and keep it just nursing.
Kind of celebrate the nursing profession and how someone's life can change because of their profession, and how the growth and the evolution of someone from school to their current career, even if they're in school now or if they've already graduated, or how they've moved from a different profession into nursing. And
Right. And nursing, so many people I've talked to too, they just really love this career path because it gives you so much diversity. You are able to go into different areas of practice and specialize in so many different kinds of things. And it's a really special profession to be in. And I'm grateful that I landed in it. So
yeah, we've met a lot of interesting people, and we want to introduce them to you guys.
Hi, I'm Christine. I'm from Mississauga. I am a nurse here. I work on the allo stem cell transplant floor.
Hi, my name is Dava, and I'm currently doing my bridging RPN to RN My parents, they were from Tibet, and I was born and raised in India. It's been 2 years. I've been working as RPN. Graduated from college in 2017. Since then, I'm working as RPN and doing my full-time bridging at the same time.
Hi, I'm Jessica, and I'm an RN, and I'm originally from Richmond Hill. What up? GTA.
Hello, my name is Ram, and I'm a registered nurse. I'm from Toronto. I'm originally from the Philippines.
Every superhero has an origin story, and so do our nurses. So we wanted to ask them when and where did they start their nursing career and what led them to the position they're in now.
Around university, I didn't really know what I wanted to do, but throughout university, I was actually volunteering at the ER, and I kind of just like watched the nurses and get to see what they were doing. And so, I was like, you know what, maybe I'll give this a try. I mean, I've always wanted to work in healthcare. I think my family all expected me to go into medicine because I had a lot of family members in medicine. So I didn't really see that for me, like becoming a doctor. So I was just exploring like what kind of careers in healthcare I could do. So yeah, and I was like, you know what, I saw what the nurses were doing in the ER, and I was like, maybe I'll like look into that, give that a shot. Nursing's really flexible, so that was kind of appealing in a sense. So yeah, then I applied to U of T because I had a previous degree. I did just a general bio degree, and I did the 2-year program.
So I originally had a Bachelor of Science, and I specialized in biology. And I think from like the very beginnings of my life, there was sort of this expectation that you'd be a lawyer or a doctor. And so I had really worked my way up to like apply to med school, and I had applied twice in my undergrad, and I didn't get in. So I guess when I graduated, I was sort of at a loss for what to do. I wasn't willing to move to the Caribbean to study medicine, and I didn't really want to work in a lab studying invertebrates. So I just had like a very candid conversation with one of my friends, like over coffee, and we were just talking about the future. And she had mentioned to me that a lot of her friends were nurses. There was like a family of friends that she had, and all the daughters in that family were nurses, and she was just talking about how beautiful that profession was, and she felt that I was really well suited for that role, and I just sort of took her advice and I went for it, and no regrets ever since. How I got to bone marrow transplant, for some reason I knew I wanted to be in oncology, like even within the scope of medicine. I always thought I wanted to be a doctor in an oncology setting. And so when I had specified that area of interest for my consolidation placement, I was put here. And then I got hired out of my consolidation.
Ever since I was a kid, I have always wanted to be in the medical field. But I couldn't, my parents couldn't afford to send me to medical school. So I chose nursing instead because I think that's the closest to being a doctor, like being in the hospital, working in the hospital, being with patients. So anyway, I graduated nursing in 2004 back in the Philippines, and I have a Bachelor of Science in Nursing degree. And then right after graduation, I work right away in the hospital. I work in the neuro-intensive care unit as an ICU nurse. I worked there for a year and a half. That first experience was really great because it gave me a lot of experience, a lot of skills, a lot of technologies that really prepared me for the nursing profession. But then I find that working in the ICU was really challenging. So I moved to another job, which is teaching. I taught nursing school for 3 years. But then at that time as well, I felt like I was too young. Like I wasn't ready to teach. My experience and my knowledge and experience I wasn't ready. but I lasted for 3 years. So then after that, I went back to the hospital where I worked before, but this time I worked as an assistant nurse unit manager, the same unit, which is neurointensive care unit. But that didn't last long because my visa arrived and I had to move to Canada. Well, when I moved to Canada, I had my papers assessed, and while waiting for the assessment, I worked in the retirement home as an unregulated care provider. So it's basically working as a nurse, but you're under the supervision of a registered nurse. And then my eligibility arrived, and I was one of the lucky ones that they told me, okay, just take the test, just take the CRNE, and if you pass the test, you can get your license. Unfortunately, I failed my CRNE twice.
Oh no.
Yeah, I failed it twice because I was under a lot of stress at the time.
Yeah, for sure.
With
It's so
family,
stressful.
with family issues and other issues, I was so stressed. I
Mhm.
couldn't focus, so I failed it twice. But on the third time, I passed. But that time I was, my experience was already expired. So my clinical practice already expired. So the CNO told me, you have to go back to school. So I moved to Toronto. I was in Ottawa at that time. So I moved to Toronto. I went to college. I studied the academic pathway for internationally educated nurses. So I finished that and I already passed the test. So they gave me my license to practice nursing. So my first experience as a registered nurse was in the palliative and oncology unit. That was also very challenging. And then I only stayed there for a year. I moved to the north, in Northern Ontario, in the place called Ottawa Piscat. I worked there for a year as well, and then I moved back to Toronto, and I'm still there. A lot of experience.
Been all over Ontario.
A lot of
And also in the
experience.
Philippines. So you have a heck of a lot of experience.
A lot of experience, a lot of places that I worked.
It's a big variety too. Like it's a good variety of a lot of different settings.
Yeah, and experience is, is good.
I told you earlier, I was born in India. My parents, they took refuge from Tibet. So basically, we are residing in India as a refugee. And from there, as you know, India already doesn't have a good healthcare system. And on the top, if you are in the refugee status, marginalized community, you basically have nothing to healthcare. And being a refugee kid born in a refugee community, I was born without proper healthcare. So that could be one reason to become a nurse. Secondly, well, it's kind of a personal story due to our grandparents and parents. They died really early due to undiagnosed medical condition. They didn't got proper treatment. So my dream is like after doing my nursing program and getting proper experience, I can give back to my community and help them to raise awareness, or should I say advocate for my community to get proper healthcare. It's kind of about political, social, personal factors that made me to do nursing. Yeah,
It's a passion.
exactly, and it's again a passion. And
But it wasn't your first passion.
nope. Like most of the nurses, nurses profession is always the second kind of choices. Yeah. So in India, I was, I have a diploma in contemporary artist, and then for a couple of years, been to Europe for a couple of years, followed my dream, and then when I came back to Canada, I felt that the art is not that how can I say, had a good scope and you can find job easily. That's where it started.
It's not as lucrative.
Yeah, I jumping kind of, yeah. So my second plan was doing nursing.
It's a great second choice.
Yeah, exactly. And I have no regrets. I
Good.
mean, yep, I'm enjoying as a nurse and enjoying as a nursing student.
Did you ever have a mentor or Nurse who inspired your practice?
I had pretty great clinical instructors and a really great preceptor for my consolidation. But one of the clinical instructors that stood out for me was my very first acute care instructor. She was, what do you say, like tough love. It was a rough time. I mean, it was our very first acute care placement, so there was like way more critical thinking, way more like acutely sick patients. Prior to that, I think we only did a rotation in geriatrics and a rotation in maternity, very short one. So our patients back then weren't, for geriatrics was a lot of like bed baths and like just general care. So on the acute care placement, so my CI was a ICU nurse, and so she expected us to know our stuff. We had to know our meds. The way our school had it was that, so our clinical days were Thursday and Friday. On Wednesday, we would have to actually go to the hospital for like a couple hours just to get like the patient profile, the med list, and things like that. And we would have to research like every single medication. So it was a neuro floor, but we had a lot of like medicine like patients. And so I remember like opening up I forgot what their system is called, but like seeing the med list and crying if it was like a medicine patient. You'd have like 20 different meds and you had to know every single one, because in the morning prior to you starting to administer your medication, she would go up to you and like ask you every single one, and you had to answer it correctly twice before you became like independent. But she was like so intimidating for me, and so I would just like blank or forget.
That was inspiring for you?
No, I'll get to that. Like she was tough, but at the end of it all, like I realized how much that was beneficial in a sense, because I mean, going into it, it's like I didn't have a lot of confidence, but like realizing like I was able to do things, I was able to push through all of that. And she really pushed us to think, and working now like as a nurse, like I realized like how much I needed that push. You couldn't just be babied the whole time, right?
I feel like so many people who work here are like inspirations to me, or have been mentors to me in this like the last 3.5 years. But if there's anyone in particular, definitely there's one nurse in my mind where I really want to like aspire to her practice, and the way I see her interact with her patients and family members, I'm just like so blown away, and I definitely try to like copycat her kind of style and like how she is. So yeah, but everyone here is amazing. I just feel like I learn from everybody.
Yeah, I mean, going back again to my origin where I was raised in a refugee community, I still remember when I was really, I think maybe around 5 or 6 year old, there is a nurse. I still remember her name and her face. When I'm back home last year, I met her. She's a retired nurse now. Yeah, so when I was 5 or 6 years old, because I told you we don't have proper healthcare facilities, and I got sick really that time, and I was admitted in our small 6-7 bed ward. And now I realize that I guess they don't have a proper like treatment such as like medication, antibiotic or whatnot. And she helped me. I'm reflecting now. It looks like she was supporting me emotionally, and I still remember she used to give me some biscuits all the time whenever she comes. And now I feel like it's more of like an emotional presence, and that relationship, trust. I think that's one example I can think when
Like the therapeutic relationship.
exactly. Yes. What she was trying to do, I will follow that path in my nursing career.
Was there ever a time when you wanted to quit nursing?
Yes. I can't think of one specific moment because I feel like when things are hard, they're really hard. And I think a lot of that has to do with either loss or witnessing suffering and workload. So some days where you're just feeling like really overwhelmed and you feel like you can't possibly do everything that's expected of you in the 12 hours, and when you have to stay overtime. I think in those moments you just feel like really overwhelmed and you just want to quit. And so I've definitely had a lot of those shifts, but you bounce back and you realize it really is a privilege, even in the moments of suffering, because that's like a huge question for me, and why we nurse. How do you be there with people in their suffering, or with family members? How do you make sense of that? So a lot of big life questions, I think, that make me reflect on what is our purpose as nurses to be here? And when it gets really overwhelming, especially when there are patients that you feel like you really connected with and they're going through a lot, sometimes you feel like it's too much. But yeah, I don't know. I always bounce back. I feel like I come to work the next day and I'm like, I can do this.
Honestly, all the time. Or most of the time, not all the time. Most of the time, especially after a hard work, or really busy day. I remember when I was working at palliative and oncology unit, it was so busy. A lot of patients are very, very unstable. And sometimes I feel like it's overwhelming. It's overwhelming sometimes.
It's the patient situations, or just the work environment situation with the staff and...
It's mostly patients. And of course because it's busy, it's always busy. We're always working short. A lot of people call in sick. Our loads are, the load is added.
You're trying to cover the work of one other person.
Exactly, yeah. So when you experience that, you feel like, okay, I think I'm gonna look for another job, an easier job. But most of the time as well, you see the beauty of nursing. Especially when I went to, in my present job, when you see patients progress, it's really amazing to see them. Okay, they are admitted, they can't do anything. They are really dependent, but they are discharged independent, which is amazing. Wow, you see them progressing every day, and you're part of that process. I enjoy that. I enjoy that, seeing that side of nursing. Going back to your question, if I want to quit, yes, I want to quit, but I also, the beauty outweighs the bad ones.
I don't know if it's whether I want to quit nursing or if I want to change where I'm working, not necessarily bedside, but or maybe going to a clinic setting or something like that. I'm not sure. It's a tough thing.
Was there ever a time that you wanted to quit nursing?
Nope. And I started working, and as I say, since 2 years now, and I still feel kind of like I just started working yesterday, and with that energy, with that kind of learning attitude, and fresh. And I can see I'm quitting nursing for at least a long time, but we never know how the life's gonna end, right? But no, I'm really excited, and I will definitely continue nursing.
A lollipop moment is when a nurse or a patient had an interaction that made them feel fundamentally better. A special moment where one individual positively shapes another person's life, but may not realize his or her impact. You can have a huge life-changing impact on someone and not remember anything about it. Have you ever had a lollipop moment? Has someone impacted your life greatly, but you have not mustered up the courage to tell them?
There was one shift where it was a night shift and I wasn't really into it. And I think I was really just focused on trying to get everyone into bed and just getting my work done. And I just had this really nice moment with a patient's husband who, you know, he was kind enough to mention to me that he thought that I was like a really good nurse, and felt that, like, you know, when he was like, when I see you down the hallway, there's always a smile on your face, and I just think that, like, this job is for you, like, you know. And it was something really small, and I wasn't expecting it, but definitely made me feel like, wow, like I'm meant to be here. It was like a sign almost, because when I was feeling pretty blah about the day, you know, I was just reminded of that. So yeah, I think about him and her a lot when I go through rough patches.
We had a really young patient. I had her early on before she got like pretty sick. And like I always try to, because she was young and like clearly a bit more anxious, I would like always try and joke around or like throw in like little jokes just to cheer her up as I was like, you know, doing my care and stuff. And I never knew if like that stood out with her, because she wasn't like, she's not like she laughed all the time, but sometimes I would get a smile. But anyway, so when she got more sick, I just remember there was one night, or well, morning, I was helping to clean her with another nurse. And it was like morning time where it's a little bit more busy because we're doing blood work and like all this like wrapping up stuff to do just before the day shift comes. So we were done, and the other nurse that was actually her primary nurse that night just said to me like, okay, yeah, we're done, so you can go. I know you have like some blood work to do, and I was like, yeah, like it's fine. So as I was about to leave, but that patient was like, can she stay for a little bit longer? Yeah, and I was like, oh, okay, which I was fine with because I was actually pretty much done. So I agreed to that. But like, you know, just that kind of stood out. I was like, whoa, okay, like she remembered all that. Or at least I had a good impression with her, that she felt comfortable with me.
That moment has changed me now as a nurse and as a person. And definitely, when I go back home, if I meet her, I will definitely tell her all the stories and how I will follow her path, and
Like she made an impression on you.
exactly. I mean, it's after those years, like still, it's fresh in my mind that every time I interact with a patient, I always remember and reflect that moment, and I can put myself in their shoe, and I can see exactly how the patient feels at that moment, just doing nothing. I mean, even if it's nothing, just you're there, but how that can change the patient, how should I say, the illness trajectory, should I say. And yeah, but that definitely I will go back and then.
Do you know her?
Yeah, I know
You know
her.
who she is?
Yeah,
Like
yeah,
she's,
yeah.
oh, okay.
Yeah.
Okay, yeah, tell her.
I'll tell her for
Give
sure.
her a lollipop.
Yep, I'll tell her for sure. Yep. Even she may not be like remembering all those stuff after 20, 25 years.
One experience I've had was when working in the palliative and oncology unit, where I have a young patient with cancer, and the mother was always there to take care of her. So eventually the patient died, but seeing the opposite, the mother seeing her daughter die is really, for me, it's heartbreaking, because it's natural that we see our parents die when they get older. But this time you see the mother really grieving for the loss of her daughter. And I was particularly close to this patient and mother. And at that time when the patient died, I wasn't assigned to the patient, but when I heard, I went to show my sympathy to the mother, and the mother just cried to me and cried and cried and cried and cried, and we were hugging each other, and I also cried. I was crying with her. And I really feel her heart was broken. So that's something, a very memorable experience for me. I don't know if it's a lollipop moment, but it's a memorable moment for me.
I think that it's Definitely a lot, like the word lollipop makes it sound so kind of like lighthearted. But I
Uh-huh.
think that what you're describing
Mm-hmm.
is the lasting connection that you feel with someone, no matter who it is, if it's a
Yeah.
patient or a family member or another nurse,
Mm-hmm.
and the the lasting impression that it puts on you, like
Mm-hmm.
they might not know when you go in every day that that patient or that family member is in the back of your head after you leave, because they
Yeah.
might just
Mm-hmm.
think that it's your job and you're just there, but nurses carry things home with them.
Being there for her helped her, release the grief, and the sadness that she's feeling. So I'm glad that I went there and offered my sympathy. At least I could help her in that way.
Question number 5. Do you have any future nursing plans?
I'm still kind of exploring what I want to do, especially with my career. I played around with the idea of, getting my NP, but I think that's something I want to research more in a sense of, like researching and also like talking with other NPs or people that are currently doing the NP program just to see if that's like a right fit. I feel like I do want to go back to school, but I'm still not quite sure what I want to do yet. So that's something, yeah, it's an avenue I'm still like currently exploring.
Yeah, so right now I'm currently working on my master's of nursing at Ryerson. So kind of back to that question of suffering and death and dying, we see, unfortunately, like it's just the way of life, but we see a lot of that around here. And I entered my master's program with the interest of palliative care. So I would like to work physically like on a palliative unit, just the opportunity hasn't come up yet. And hopefully with the master's become like a CNS with a focus on that and pain management. Just think that that's like a really interesting area.
I don't have any particular nursing plans, future plans, because right now I'm working to become a doctor. I'm doing my pre-med courses, but if that doesn't happen,
Don't say that.
well, okay, but I'm okay with what I'm doing right now as a bedside nurse in the physical rehab facility.
And our last question, what misconceptions about nurses do you wish you could clear up?
So I can always relate it back to my community as my parents, grandparents, they are kind of traditional, conservative kind of thinking, and they always see nurse as a female.
Mm-hmm.
And yeah, I definitely want to change their conception of having male being a good nurse, and they can be really good nurse. Yeah. So definitely, I'll try to change that conception if I can. Yeah, it's kind of my long life journey, how I've been through, born and raised in a different country with different culture. At the same time, my own traditional culture. I was born in a generation with the internet and everything on, so I've been through a lot, and I saw those transitions, and I can definitely see myself going back and try to change their mind if I can. I guess most of the male nurses, they do have same kind of feeling that they are kind of marginalized in the nursing profession.
I guess the one that's like personal for me is, well, because like I mentioned earlier, my family, I have a couple doctors in my family, and so everyone expected me to go into medicine because like early on when I was a kid, I expressed like I wanted to be in healthcare. And I guess as a kid, like I only thought the only avenue was becoming a doctor, so that's the expectation. And I feel like my family still expects me to do that, and they see like nursing as a stepping stone to becoming a doctor. Just totally not true. Nursing and medicine is like completely different specialties. We work together as a team. Doctors also rely on us for our opinion. We're not just their assistants, just following whatever they say. We have our own set of critical thinking, our own clinical judgment that we use. And we just practice differently, which come together to give the best care for our patients as possible. So yeah, I don't know. It's just some people just think like, yeah, people go to nursing because you can't make it to med school, or it's a stepping stone, and that's not true. It's different. It's a different side of healthcare that we need too. It's It's just hearing that all the time with my family. It's pretty draining.
My answer is not very very obvious in Canada, but in the Philippines, some also as well. I experienced some here that nurses are just considered helpers. So I feel like they take advantage of the nurses. They think that nurses are helpers, and how do you call that? Like
Underappreciated.
not in the level of the other professions. We are below the level of the other professions. We are not appreciated much.
Like other staff or by patients?
By patients and I think the general public. As I said, it's not very common in Canada.
Mm-hmm.
But back home in the Philippines, that's very apparent, where doctors are like God.
You noticed a big difference when you moved here?
Yeah, I noticed a big difference. Yeah. Here we are equal, right? Like, every professional is equally part of the team. And the other one is about misconception is not in terms of how we are perceived, but in our practice, that it's okay to work short staff.
Mm-hmm.
A lot of times at work, a lot of nurses experience working short staff,
Mm-hmm.
and that's not okay, because it can impact patient care. It can impact the work of the nurses. It's additional load for the nurses, but we are not paid to do extra work. It can cause stress, to the nurses. That's why I think many nurses call in sick, because they are stressed, because they are working a lot. Their loads are doubled, and they're not paid for doing that. I don't agree with that working short is okay. If we are working short, then we have to be paid extra for the extra work that we do.
Just to bring things back, when you think of medicine, you think a lot about physicians and their role in a patient's care. And of course, they have a really important role to play. But I think one misconception that I have sort of debunked in my own life is how nurses are such a vital part of patient care and just making their experience of being hospitalized better, way better. And the amount of times that I've seen my colleagues advocate for patients and stand up for them, making suggestions in rounds and directing patient care, it's really astounding, and how we all really listen to one another. So yeah, I think one misconception of nursing that I had as a university student was that they just followed orders and they didn't do much. But oh my gosh, I was so wrong. We do a lot. Yeah. And we're just a force to be reckoned with. We are really powerful. So yeah, to anyone who wants to be a nurse, it's definitely a beautiful career path to choose, I think.
We want to give a big thank you to all of our special nursing guests we interviewed. We love and appreciate all the stories you shared with us for Nursing Week.
And we really hope that this helps you guys reflect on your nursing practice and think of all the special times and special moments that you've had with either patients or family members or other staff members.
Maya Angelou has a quote that we really like for this episode to kind of wrap it up. And they may forget your name, but they will never forget how you made them feel. So that's for the patients, and even us, sometimes we can forget patients' names, but we can always remember how they make us feel, and just your day-to-day impact on patients is so important. And I think they really take that home with them.
Yeah.
So it's good to reflect on that every day.
And we can take that home too with our lollipop moments. Are you making a lollipop popping sound? Love it.
Pretty good.
All right, guys.
Pretty good.
Thank you so much. Have a happy nursing week.
Happy nursing week.
Take care. Stay safe.
Catch you on the flip side. Sorry, I say that every time.
Nurses
Don't
out.
put that. I'm so good. Yeah.
All right. I'll see you later,
take
guys.
care, everyone.
You've been listening to What's Beeping, a nursing podcast. For more information about resources mentioned in this episode, check out the links in the show description. If you have thoughts about what you heard or how we're doing, leave us a comment. And don't forget to rate and subscribe so you never miss an episode. Your input goes a long way, and we'd love to hear from you. You can also find us on our social media, where we try to keep up with all of the trends in nursing and healthcare. Follow us on Twitter and Instagram. Both handles are @whatsbeeping. Thanks for listening, and have a great shift.
The views expressed in this podcast are ours alone and do not necessarily represent those of our employers or institutions. All anecdotal scenarios have been fictionalized in order to maintain confidentiality and follow the Personal Health Information Protection Act. Any similarity to actual persons, living or dead, is purely coincidental. The content is for informational purposes only and should not be taken as medical or professional advice. Always consult your regulating body or employer prior to making changes in your practice.